Welcome to Cancer Research Link on iCCaRE TV. I am Dr. Folakemi Odedina, and I am proud to be one of the program directors for the iCCaRE for Black Men Consortium. I am really super excited about who we have today. We have one of my brothers from back home. His name is Dr. Zubair, and he's going to be talking on this outstanding research that he does. But first of all, let's get to know him. Dr. Zubair, welcome.
Thank you.
So could you tell us a little bit more about your background? We're not talking science now.
Oh, excellent. So by my name, I'm Zubair. I'm from Kano, northern Nigeria. I went to medical school there. My alma mater is Ahmadu Bello University Medical School. I graduated in 91, then left to England. I did a PhD in cancer immunology. After that, through the green card lottery, I migrated to US and started as a postdoc at the University of Pennsylvania, working on cancer vaccines. And from there, I decided to be a real doctor. I did all the USMLE, and then went into a residency program in pathology and laboratory medicine, and then a fellowship in transfusion medicine and cellular therapy. And that shaped my career. Really, all in the last 25 years, I have been really in transfusion medicine and cellular therapy. This is a field that involves blood transfusion, bone marrow transplant, apheresis like red cell exchange for sickle cell, plasma exchange for many indications. One of the common is like kidney rejection, or condition that associated with even patients that have autoimmune disease.
Yeah, that sounds good. So I'm going to go back a little bit because we need to learn more about your background from Nigeria. So for people who already know me, I'm originally from Nigeria as well. I'm from the southwest part of Nigeria, and you are from the north.
Yes, North Central.
North Central part of Nigeria. I got that right.
Yeah.
So I know a lot about the Ahmadu Bello University, very outstanding institution. I've been there before. I have so many collaborators in investigators. So kind of tell us a little bit why did you make the decision to sort of, move from Nigeria, because home is always home. Tell us a little bit more about that.
Well, so like you said, Ahmadu Bello is really a vibrant medical institution. Of course, a general university. There's all other disciplines involved as well. From our, lecturers to our colleagues, clearly we realize in search of knowledge, you need to go far out beyond the walls of the institution. I'm really academically oriented. I'm excited about knowledge, and I wanted to really be a pioneer to discover new things. So not only what is in our textbook, but also to be the discoverer, to be the person who uncovers something new to help humanity. So with that background, and particularly some of our professors are from abroad. I remember Professor Mobogunje is a Yoruba, but he trained in Boston, and he was sharing with us, the opportunities out there if we really want to excel. We had Professor Igla from Hungary. We have quite a lot of international visiting professors. We also have medical students from around the world visiting through American Medical Association and other student body. I happen to be Secretary General of our Medical Student Association, APAUSA, and that also enticed me to kind of explore and relate with other medical students. I remember I did my electives in Switzerland in my fourth year medical school. And that really opened my eyes, and I realized for me to achieve my goals and vision, I need to go far. And that's really the drive.
That is really wonderful. I mean, I think it's such a great thing to really, you talk about your passion for scientific discoveries and for knowledge. And I think for those of us who are watching and they're now, in the United States, they are outside the United States, they can say that the world is actually, it's a global world. So you could start from somewhere and then, end up having your scientific discoveries elsewhere. Obviously, your brain drain for Nigeria is a brain gain for the United States, and it's great to have you as a colleague. But before we start talking about your discoveries, tell us a little bit more about your position at Mayo Clinic.
Yeah, so currently I'm the Dean of Education at Sheikh Shabud Medical City, which is a joint venture with Mayo Clinic in Abu Dhabi. We were sent to set up the medical center there. So I've been sent on assignment. I've been there two years, a few months, and we're just establishing another Mayo Clinic there. I still maintain the medical directorship of the human cell therapy lab that deals with novel therapies, experimental cellular therapies. So I split my time between UAE, Abu Dhabi, and Mayo Clinic, Florida. I just go back and forth.
Very well traveled. I can see you getting all that mileage.
Yes, exactly. And I still maintain my basic research lab, which I know we will talk about. But it's really exciting being there in another country doing Mayo work and then coming here and also continue with my research.
Yeah. So that's actually a great transition, talking about scientific discoveries, because what this show is about is for us to be able to bring the outstanding science that is being done in different areas and look for what implications does it have for public health, especially what implication does it have for Black health, whether in the United States or outside the United States. So I want to take this opportunity for you to, in layman's terms, so that we can understand it. I know you have done a lot of outstanding work, a lot of discoveries. Your stem cells research is going into space. We want to hear about that. But just for our audience, talk a little bit more about what is stem cell research? What is it helpful for? Why do we need to really understand what stem cell research is?
Yeah, so I mean, people think they know stem cell, but to put it in a layman's language, is just the seed in any organ. These are specialized cells. They are really there to, if you call them, we call them primitive. Specialized, it means cells that have differentiate to make specific function, like insulin and all that. But stem cell, their main function is to repair and replenish damaged tissue in every organ. So if you take the heart, there is a cardiac or heart stem cell. In the brain, there are brain stem cell. Every organ has, and these are very few cells. Actually, studies show there are about 5% or less in every organ. So, and the nature control their numbers tightly because, it's like you're growing a crop. If you have too many seeds, they grow too much. So really, the number of stem cells in any given organ is limited. And so the primary role is really tissue repair and replenishment. So we, as you know, stem cell therapy has been used mainly to treat cancer patients, and mainly patients with blood cancer, because the treatment in the process to kill the cancer also kill all the blood cells. So the way to do it is either you collect the patient stem cell, blood stem cell, and save it, and then treat them with the chemo, and then after the chemo you rescue them with the patient. Or you get a stem cell from a donor, a healthy donor who would donate and help the patient. So like I started, one of the big challenge is, one, you need to have enough donors. And particularly for Black population, most of these either blood banks or stem cell banks lack a representation from Black communities. Some of it is just lack of understanding. Sometimes they're not approached appropriately. Already there are programs that are targeting to make people awareness. But this absence of or adequate representation of Black in the stem cell banks really impact the Black communities themselves, because we know if you're getting cells from a donor, getting it from somebody of your kind has a greater chance of those cells to survive in you and live longer, and also lower risk of what we call graft versus host disease, where the cells, when they get in, they start attacking the recipient and then causing all kinds of So that is really value for our brothers and sisters in the Black community to be donors. Because by doing so, you never know, it could be you, it could be your relative needing a transplant. And usually the first goal is to look in the blood bank or stem cell bank to see are there units that are compatible. So the chance of finding a unit, a stem cell unit, be it a cord blood or a bone marrow or even just blood product, is really higher if we have more Black donors donating. They are there in the so
that's a very important it's very important, so I want us to sort of listen very carefully to Dr. Zubair as we discuss this. I want us to take time to really discuss what you just said about the fact that we need to really take care of ourselves and our community by donating stem cells. Let's step back. Can you describe to us, you already mentioned cancer. What are some of the chronic diseases that we as Black populations are highly susceptible to, that this area of stem cells? Because I really want our audience to understand what you're saying and why it is so important.
Yes.
What are some of the examples of the diseases that affect us as a community that we can use?
A good example is sickle cell.
Okay.
We all have relatives or we know somebody who has sickle cell. And today you can be cured by bone marrow transplant.
Wow.
Yeah. And you either get a stem cell from your sibling, if you have somebody, a sibling that match for you, or somebody randomly who match for you through a registry can be a donor. Now, this is where it is very crucial. The chance of you as a Black man with sickle cell getting a donor that match for you is higher in a Black community, or is higher in a registry where there are Black representation adequate. So and currently the Black population are really at disadvantage because they are disproportionately underrepresented in those registries. So so the registry is not that the stem cell have already been collected. People go and sign up in this registry, so they get your information, they collect your blood samples, they do some testing, and they keep a record of your HLA type, your blood type, and all that. So let's say somebody in Nigeria or in Uganda needs stem cell transplant. The doctors there would log in online and go to this registry website and search for a donor that match the profile of this patient. So if the registry doesn't have a lot of people from that region, the chance of finding somebody who match is very little.
Wow.
So, and that's why, again, I could not emphasize more to be a donor. It's a selfless service. You are helping your own community. I mean, if you look
and you
at
might be helping yourself.
Yes, and you might be
and
helping
your family members.
Yes, absolutely.
Yes.
Absolutely. So I really think, and this is a major problem.
Wow.
If you look at all the registries, there is National Marrow Donor Program in the U.S. funded by Congress. There is World Marrow Donor Program that is international. All of those registries, they are like in, African or blacks in general. They are few, but they are not adequately considering proportionately how African population or black population is in the world. So again, it does a lot of service to donate. Now,
I want to stop you in a
yeah.
minute because I think it's very important that our audience understand what you're trying to, what you're trying to say. We keep talking about health equity. We keep talking about health disparities. We keep talking about building a healthy community for our black communities. The question is that what are we willing to do to ensure that we achieve health equity, that we are building healthy black communities? One of the things that he has mentioned is that, apart from cancer, one of the things that affects us the most is sickle cell, right? And we don't, with having donors who have from the black communities, this is one way, that we can help with our community. And this is so very crucially important. And I think this is one of the reasons for this show. Let us understand what is affecting our communities. Let us understand what can be done, and let us understand what should be done. If you were to, I just kind of want to go back because I really it's very important that our audience really get this. If we are thinking about all these banks that you're talking about, what do you think is the percentage of individuals of black ancestry that are part of the donor registry?
Now, so these registries, even though they can be under the umbrella of National Marrow Donor Program, varies. And I can tell you, in some registry, the representation could be 1%, 2%, 5% in some. Again, it all depends on the community where they are.
Thank you for sharing that.
Yeah,
we make up how many percentage of the population?
Absolutely.
And then we're only giving it 1%.
Yeah.
That is not something. So for those who are listening and who are saying to themselves, I want to do this, but what does it take? What does it mean? I know one of the things that you mentioned is you just need to sign up.
Yeah.
But if I sign up and I'm a match, what happens to me when I get called? Can you talk a little bit more about that?
Yeah, so once you sign up, you receive some document to say things about yourself. Again, these are basic, your age, your gender, and then they collect a blood sample from you. And the blood sample would be used to get your blood type, and then your HLA type, which really identify your tissue. And basically that's it. You don't really need to do anything. You can go 5 years, you don't get a call, but you can get a call. Again, this is not something, you don't need to pay anything. You don't get paid. It's a selfless service. You're donating this.
Yeah.
So that's all it takes. Now, once there is a patient that need your cells, that's where the action is. You get call, you may need to go to a collection site near you, and they have Mayo Clinic here in Florida. It's one of the centers for doing that, for collecting donors for National Marrow Donor Program. But there are several around the U.S. and other places as well.
Is it painful? I know my people, and I know myself. So the question is, okay, I hear this, I sign up, they call me, and I come to Mayo Clinic to donate my sample. What happens?
So the most common way usually is you get some medicine that you take. Is usually an injection, and it stimulates your stem cell to come into circulation. And then you just go and lie on a bed or a reclining chair, and we have a TV screen with selection of all kinds of
I like Nigerian movies, so I can watch Nigerian movies.
You can have that, and then a machine which looks like a dialysis machine is just connect to. Usually, we don't need to put a central line. Usually, it's done peripherally. Especially, you are healthy, your veins are good,
Okay.
and you know, in roughly about 4 hours, you are done.
Oh, wow.
The side effect of the medication is some people have a little bone pain, which can be easily dealt with that simple Tylenol. In general, there isn't major side effects to say, and this is done over and over, many donors. Some people may have a bleed from the site of where the cells are collected, because we use a blood thinner that prevent the blood from clotting in the machine. But even that, by next day, people, you can go back to work the next day, you know.
That is great information. I know that we have come to the end, but I really want to ask one more question before we go, because we cannot have an outstanding scientist like you. How many people get the stem cell to go into space? So in 1 minute or less, tell us, what are you doing in space?
Well, you know, it's all related to stem cell. We really wanted to understand how we can expand, how we can grow them, which is really hard to do in the lab. So we think if you take out gravity, you know, the holy grail, if you ask me what is one thing that affects all our body function, how we look, how tall we humans can be, is all to do with gravity. Because if we evolve on, let's say, Mars or Jupiter, we wouldn't look the same.
Would we be taller? Because I really want to be taller. I might have to go there.
Well, maybe taller in Mars, because Mars gravity is one third of that on Earth. So, but basically we're studying stem cell and finding ways to grow them, and also understand the effect of absence of gravity on the cells. Because as humans started to explore further into outer world, we need to understand what would be the effect of the gravity on them. So one of them is bone density. You know, astronauts lose a lot of bone, so we're studying the impact of that. But understanding how gravity affects bone density would make us understand, like, osteoporosis for women on Earth. So even though we're studying stuff in space, the application, the understanding of it would be relevant to our problems on Earth. Because people say, why do we need to go there? Well, you know, microwave, you know, a lot of things that we are used to, cell phone, evolved from space exploration. So we do those things, but it makes us understand the problem on Earth. So that's really it.
Thank you so much. This has really been very unique conversation with you, and I'm so glad. So not only did you give us the nuggets about the importance of stem cell and why it's very helpful and why it's very useful to us as Black communities, but the idea that we need to be able to donate and we need to volunteer so that we can build a healthy community. It's all about our Black community globally. We need to be able to donate and represent ourselves. But it's always a pleasure, you know, because sometimes as Black communities, we don't see ourselves making such significant contribution to the science. And the scientific discoveries, and to have somebody like you who is from our community, who is doing all this, you know, great stuff, going into space, you know, so we can say to the younger ones coming behind us, you can go to space. Look at Dr. Zubair is dying. But thank you for joining us,
Thank you,
Dr. Zubair. Really appreciate that. And that's our segment today on Cancer Research Link on iCCaRE TV. Thanks for joining us.